Hey guys, welcome back to another episode of Tattoos and Telehealth. This is my great colleague Nicole Baldwin, and I'm Kelly White. We're going to chat with you guys today about some interesting stuff regarding weight loss. But before we do that, our lawyers make us say that this is just a chat with a couple of gals. This conversation does not constitute medical advice, and this also does not constitute a patient-provider relationship. So today we are going to talk about some different ways that you can supplement what you're doing for weight loss. And by supplement, I mean other stuff besides what you see with the branded injections. We can't say the branded injections names, and that's okay. But I want Nicole to chat with us because she is our weight loss expert. She's the gal, she's the go-to. You have weight loss questions, she's your girl. So, what in the world are mic injections? Is it mic, mic? What is it? MIC? What are these injections? What does it mean for our patients? Can they take them every day? Can they have it?
It's the Mic drop
The
mic
mic drop.
injections.
Mic drop.
The
I
Mic
love it.
drop mic
Drop.
injections.
I love
Shots
it.
fired, shots fired. The wellness edition.
I love it. So tell
Yeah.
us about these injections because I have patients that ask about it. I'm the functional medicine girl. Nick, you're the weight loss girl. What are MIC injections? What do they do? What's all the hype? Why do people want them? Pros, cons, goods, bads. What is this?
So boosting your burn, really. It is some people call them the McBurn injection because they
Like
help you
metabolism
burn.
burn?
Yeah. So if you ever feel like your metabolism needs a jump start, like you're doing all the right things, but the scale just won't budge or your energy is lagging. So today we're going to dive into the MIC injections, what they are, who they help, and what you need to know.
Love
So
it.
MIC stands for methionine. Did I say? I cannot get that out. Methionine.
You got it.
Methionine. And that is an essential amino acid that helps the liver process fat. And then inositol that aids in fat metabolism and also may support mood regulation. And then the C stands for choline, which supports liver function and fat transport out of the liver. So that's what MIX stands for. But what do they do? So what does all that mean? So MIC injections actually support the fat breakdown and your metabolism to give you that boost. And with that, they enhance the energy, give you mental focus, mental clarity. A lot of patients love it for that reason alone. And it's often used in weight management programs, and that's because you have more energy, so you're busier, so it does the mood balance. And frequent add-ins to that is B12, and B12 is also used for energy, mood, red blood cell support, things like that. But so the common add-ons that are with the MIC injections is the B12, which is what makes it pink if you have a pink one. And then sometimes it's paired with L-carnitine, which is added for additional fat burning potential. And so those are the two common things that are added with it, but they are great for mostly everyone. See, the B12 is a water soluble vitamin. And so, some people they'll run their B12 level and like, my B12 is really high. Whatever you don't use, you're going to pee out. So, it's a relatively safe for most patients injection with these amino acids with the combo that it has. So it's a nice little cocktail to help with, energy, mood, metabolism, all those things that most of us struggle with. Um, so patients who might benefit are those that are in a supervised weight loss program, individuals that suffer with fatigue or just a slow metabolism, especially perimenopausal women, menopausal women, and then just your everyday normal person might suffer with fatigue for whatever reason, right? And then also for patients who suffer with non-alcoholic fatty liver disease, because it helps transport the fat out of the liver, it can actually reduce the fatty liver. So patients with non-alcoholic fatty liver disease can really, really benefit from this. And in some cases, PCOS or metabolic syndrome can be helped with this as well. It can certainly help with those. And that is something that is becoming more widely recognized as the treatment for that with the PCOS. So
Now, is it safe to take if you are in a normal BMI range, like let's say you're not overweight, but you have non-alcoholic fatty liver disease, or you have you're perimenopausal, you're having this fatigue and this overwhelming, I can't get enough sleep. Is it safe to take if you're in that normal weight range?
Certainly, 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 absolutely. It's safe for anyone in with any BMI to take in most cases. It's generally very well tolerated. Allergic reactions are possible, but they're very rare. And it's not a magic bullet. It's not just used for weight loss. It's used as a weight assistance. It's not going to, you're not going to take this and the pounds are going to melt off. This is something that's used in conjunction with diet, exercise, if your BMI is high and you're looking to get it down. But this is not the only reason for it, right? You could just take it for fatigue and that just any kind of brain fog, any kind of clarity that you need, mental focus. You can
Love
take
it.
it for other reasons other than weight loss and not necessarily have to even focus on the weight factor of it at all.
I
So
love that mental component, that brain fog, that mental fatigue, because so many of us, especially, professionals nowadays, man, we just burn the candle at both ends. These MIC injections sound like they have a much broader purpose than what we're using them for, even.
yeah, absolutely. I think patients just think of it as, oh, I've gained some weight or I need to, you know, get a quick boost of energy, but it really goes beyond that. I mean, it's not a magic bullet, right? If you're trying to lose weight, it works best with proper diet and exercise and, whether you intermittent fast or whatever, whatever type. It certainly can be used for that. But, it can be used for different things just with the mental clarity. I mean, that's a great thing. There's so many things going on now. We all have alarm fatigue, right? We get a message for this and an alarm for that and a ding for this and
Yeah.
it's not just in the medical field anymore where we have alarm fatigue, right? There's so many alarms. But it's actually just, alarm fatigue is more everybody seems to be getting that, right? We hear all these dings and honks and beeps and it's just like, oh my gosh, like I just give me some just let's just I need some clarity with my brain. So
Yeah.
but it's not recommended in pregnancy for those who are planning to become pregnant or breastfeeding, of course not. And it's also not recommended for patients with certain liver or kidney conditions without their specific provider clearance. So those are definitely hard nose. And there's other hard nose based on, every patient's different, right? It's not everybody we can just put in a box and say it's safe for everyone if like everybody has their different everybody's body's different, right? Everybody has their own fingerprint. And so you always want to check with your provider to make sure that it's safe for you. But generally, it is pretty good, pretty well tolerated. And they're only given 1 to 2 times weekly, right? There's a
Nice.
subcutaneous injection, so it's given 1 to 2 times weekly. And that can be customized based on your needs, And these are often used in short-term cycles, but what we're realizing is that they can be continued for maintenance. They can be, given, biweekly. They can be given, it can be tailored to whatever the patient needs, whatever the patient needs at that time. So that's really nice is that what we're learning is there's a big flexibility on it, right? It's not just used anymore when there is some sort of deficiency, like a B12 deficiency or some other vitamin that the patient's struggling with or some kind of metabolism that the patient's struggling. It can actually just be for continued maintenance for those things. So it can be given in several different ways and cadence. um
And these work well in conjunction with peptide therapy, like patients that are using NAD supplements, glutathione,
oh
uh,
yeah,
NAC, things like that. Like in functional medicine, I see a lot of patients that are in that wellness mode, right? Like they're
yeah,
trying to be fit and they're working out and they're supplementing with amino acids and peptides. And this works really well in conjunction with those things too, right?
absolutely, absolutely. And peptides are the new thing, and I'm so glad that we have now just started offering them because there is such a push now about just taking care of yourself, taking
Yeah.
responsibility for your own health, right? um it's always good to be able to rely on a provider, on your provider, but no provider has just one patient that they have to focus on, right? Truth be told, we are all I mean, you and I, we have our own practice. So right, so we can say we're not accepting any more patients if if we need
Yeah.
to. But a lot of times patient providers can't say that. And so they have hundreds and thousands of patients. And so it's easy to the only person that can really be in charge of your health is you. And so now patients can order labs on their own. They can go to Quest or LabCorp and they can order labs on their own. They don't even need a provider order for that. And so there's more and more things that are becoming available for patients to be able to do on their own and take charge of their health. And that's really the way that the world is going, is that patients really want to say, look, I want to take care of myself in the most natural way, in the best holistic way, if you will. And that's why functional medicine, I mean, your specialty in functional medicine has just been amazing. It's just been amazing. But that's just the way the world's going. So take charge of your health, reach out, see if you're a good candidate for this, you know. While anyone taking a MIC injection, you always want to stay well hydrated. And that our organs always function best when we're well hydrated, regardless. So whether you're on a MIC or not, hey, staying hydrated is huge. Because even hydration can affect fatigue. It can affect mental clarity, headaches, things like that. Even if you just don't, you just don't even realize it. So staying hydrated is super important, whether you want to MIC or not. But be consistent. Results build over time. MIC injections also do very well with protein-rich meals, and also with movement. Get your metabolism going. When you go for a brisk walk, get that heart pumping, get those things, get things moving. And so the MIC injections, with the ingredients in these, it really just helps to just really boost that. A brisk walk is, it's some, like when you pair them, it's like 2 plus 2 is 5, right? Because you're pairing two separate things that have this symbiotic relationship. And when you go for that brisk walk, it's like, you know, extra, if you're getting extra benefit from it, right? Because you're pairing it with the MIC injection and with those ingredients that your body already makes. And so super, super holistic. And
Side
most,
note, for women that have chronic migraines, low B12 increases your frequency of having these headaches. So if you're like me, I suffer from chronic migraines. Low vitamin B12 levels increase the frequency of migraines. So this could be something that women that have chronic migraines could even try.
yeah, absolutely. Absolutely. It would be worth a try because, sometimes patients have hormonal migraines, cluster headaches, tension headaches, all kinds of, a lot of some patients, especially as their hormones start to change in their 30s, these migraines get more persistent. And so they want to try different things. And it's worth a try. It's super simple. And something that's really not hard to obtain. So
We get that from compounding pharmacies online. You guys can come see us via telehealth. A quick visit with myself or Nicole, and we order
absolutely.
that through a compounding pharmacy. Guys, it comes to your door. It's refrigerated. You got everything comes to you quickly. Like it's very easy to obtain. You don't have to go to the pharmacy. You don't have to pick it up. We're going to get it shipped to you. It's a very simple process. Telehealth is amazing.
It is. It is. It is absolutely amazing. And we've it's really been a big push for patients because it's easy. It's from your house. It's we're board certified. This is what we do. Um, we've done several years and even decades of in-person care, and we can reach more patients this way than we could ever reach in an office. And we also reach patients in rural areas who wouldn't otherwise have access to care. If you're in a rural area and you don't have this type of provider that will help you with these things that maybe
We're
your
here.
primary. We're here.
We're
So
here.
you always want to report any unusual symptoms, rash, dizziness, GI upset. Although it's rare, it certainly can happen. When you get in the car, you always wear your seatbelt just in case. So we want to make sure that you know that you always want to report any abnormal side effects or anything that makes you uncomfortable. Um, and then I think that's it. I just, MIC injections can be a powerful tool in your health journey, certainly can, but they shine brightest when paired with good habits and with a provider support. And just ask your provider if this is a good thing and it might be right for you. Your primary care provider may be willing to send it for you. It's not about shortcuts, it's about support. So we are here for you. We can certainly help you with that. You can find us at hamiltontelehealth.com. just click get started and we will be happy to help you. If your state allows it, we can do everything via chat. And so, depends on the state requirements, but um, we're happy to see you too. We'll call you, we'll do a video if you prefer. Some patients just wanna see our face and see that we're on the other end, and that's okay too. So, but B12, I'm sorry, MIC injections combined with B12 or L-carnitine, um, sometimes even glutathione now. And things are evolving in this holistic, functional way, and we're here for it.
Yeah,
So,
yeah, for sure.
yeah.
Guys, we hope that that helps clear up the mud a little bit when it comes to MIC injections. And like Nicole said, we're here for you. Reach out if there's anything that we can do. Again, HamiltonTelehealth.com and just click on get started. We're here.
Okay, we'll see you soon.